Chapter 36, Integrative Care. Beginning with some terminology, complementary care is any non-mainstream care that's used in conjunction with standard medical care. On the other hand, alternative care is non-mainstream care that's used instead of standard medical care. And integrative care is non-mainstream care in coordinated conjunction with standard medical care. By conventional healthcare, we mean allopathic medicine, biomedicine, conventional medicine, orthodox medicine, Western medicine. In the United States, up to 66% of patients use some type. This could be conventional healthcare that focuses on what is done to the patient, where health equals an absence of disease. On the other hand, integrative practices focus on what is done with the patient, is more patient-centered. In this case, health is a strong interrelationship between the physical, emotional, mental, environmental, spiritual, or social well-being. The goals are to advance fundamental science and methods of the mechanisms of action of natural products, the mechanisms of mind emotions, and the improved research methods and tools. It can also deal with the care for hard-to-manage symptoms by improving symptom management and conducting real-world safety and efficacy testing. It can also deal with a desire to actively participate in their healthcare, engage in holistic practices that promote health and healing, therapeutic approaches with lower risks, and positive experiences with CAM practitioners as supportive and inclusive. It could also deal with the dissatisfaction of conventional healthcare due to being impersonal, rushed style. In our case study, Juanita has been an RN for 4 years now in a hospital setting, but recently, since seeing a massage therapist, she's begun to take an interest in holistic nursing. What I really want to do now with my career is work with people one-on-one to adopt more healthy lifestyles. I want to be a nurse coach. Holistic nursing is all nursing that has healing with the whole person as its goal. Holism involves identifying interrelationships of bio, psycho, social, spiritual dimensions of the person, recognizing that the whole of the person is greater than the sum of its parts, and understanding the person as a unitary whole in a mutual process with the environment. In assessment, they use open-ended questions on the patient's views of their experience and concerns, also relating to their nutrition, exercise, relationships, work, cultural, religious, and spiritual concerns, and the use of herbal supplements. For integrative modalities, they involve relaxation techniques, guided imagery, therapeutic touch, and patient education. There are many different credentials one could receive. There could be the DNP programs with an emphasis in integrative health, Holistic Nurse Board Certified, Holistic Nurse Baccalaureate Board Certified, Advanced Holistic Nurse Board Certified, or Advanced Practice Holistic Nurse Board Certified. Because she is already a registered nurse with a bachelor degree, a BSN in nursing, Juanita decides to apply to become a Holistic Nurse Baccalaureate Board Certified. She finds guidelines for the credentialing process at the AHNCC website and sees that before she can take the board exam, she'll need to complete a minimum of 48 contact hours of continuing education in holistic nursing within a 2-year period preceding her application to take the exam, and this would go along with an active period of practice. So the classifications of integrative care would be natural products, mind and body approaches, and other complementary practices. For natural products, could be dietary supplements and herbs that if some are in current regulatory climate is not effective. Also, diet and nutrition has a correlation between depression and the consumption of sweet or fatty snacks versus regular meals containing more fish, fruits, vegetables, and omega-3 fatty acids. Other mind and body approaches include meditation and mindfulness, yoga, exercise, acupuncture, and guided imagery. For homeopathy and naturopathy, aromatherapy, expressive therapies such as music and art, also energy therapies like therapeutic touch or Reiki, bioelectromagnetic-based therapies, bright lights therapy, and prayer and spirituality. Continuing with our case study, Juanita completes certification as a nurse coach. She initially was able to acquire hours working in her hospital to help improve nursing staff retention. But she has begun coaching her peers. She realized she missed non-nursing clientele, so she began to look around for a new venue. CAM therapies have a long history, everything from traditional Chinese medicine and Taoism, promoting harmony and health to bring order out of chaos. There's also a belief that health is a balance of yin and yang, And this works in the framework of acupuncture, acupressure, transcendental meditation, Tai Chi, and Qigong. Others could be in India that originated around 5000 BC. It's one of the world's oldest medical systems, where the individual responsibility for health and the five elements earth, water, fire, air, and space. Now Juanita works for a health insurance company, helping motivated patients lower their healthcare costs by using her coaching as a form of preventative care. I love it, she says. It puts the client in charge of the process, which really increases the motivation to change. I feel as if I make a real difference. The greatest advantage of alternative medicine is that A, it allows companies other than pharmaceutical manufacturers to profit. B, it offers a more cost effective alternative for persons without health insurance. C, it gives the patient more control over his or her treatment. Or D, it enables people to use the internet to research treatments before using them. A lot of loaded answers here, and obviously that answer is going to be C. Gives the patient more control over his or her treatment. For our next question, allopathic, Western, Orthodox, and biomedicine are terms that refer to A, manipulative and body-based practices, B, conventional healthcare systems, C, mind and body practices, or D, integrative healthcare. And the answer here is going to be B, allopathic, mainstream, or orthodox medicine. And for our last question, how do you personally use complementary or alternative practices? Obviously, the answer is going to vary there. And just like with nursing, I've known a lot of nurses who are very into these complementary and alternative medicines. And I've known other nurses who are not at all. And both are okay. You know, it's the big thing for you as a nurse at the bedside is neither encouraging a lot of these practices, but also don't discourage your patients from them either. And also making sure if they're taking any over the counter, any supplements, making sure we're documenting that, making sure that's on the med rec, especially making sure the guy that's writing the prescriptions is aware of what else they're taking outside of the med rec. Just to prevent any complications, because there can be a lot of drug interactions, and we really want to prevent any problems that could occur. But anyway, that's all we got for this chapter. I'll see you in the next slides.